Hi, Dr. Grove Higgins here with Coach Pat Marquez with Neuroathlete Clinic in Monument, Colorado. So continuing on with the COVID-19 risk reduction series of videos, we wanted to kind of step backwards in order to move forwards with what we wanted to show you. And we wanted to talk about what really are the risks with COVID-19 infections. And really, the people that are at most risk are the people that have breathing issues. Those are the individuals that this virus affects the most because it causes stress to the lungs and then stress to the rest of the body, but the stress to the lungs can cause a pneumonia and cause irreparable damage to the lungs and potentially lead to death. So who's at risk? Well, people with obvious diseases and are participating in risk factor rising for a lot of diseases like smoking, and then of course the people who are considered elderly. And there's a lot more there, but if you can improve your breathing, then you can potentially reduce your risk. And so that's why we'll talk about why breathing is so important.
So if we look at why we're focusing on breathing for a lot of these videos, two big aspects here. So your respiratory function is literally how well you breathe. And if we take an analogy, so if you have some dysfunctional knee movement, then you're at higher risk when you're doing sports to a knee injury because the knee doesn't move that well. And it's the same with the breathing. Everybody can breathe, but that doesn't mean everybody breathes well. And so if you have some dysfunctional breathing and your breathing patterns aren't really good, then you're at a higher risk for respiratory diseases. So we're talking about mechanics on how well you breathe and also the volume and the strength of your breathing. The second big aspect here is increasing vagus nerve activation. We talked about a little bit about that the other day, but your vagus nerve, which innervates your heart and your lungs and also into your gut, there's a huge gut-brain axis here, and the vagus nerve plays a huge role in your immune function.
So basically what we're talking about is if you breathe better, your chances of overcoming an infection are much greater. And then if your immune system is functioning better because your breathing is efficient and working properly, then the chances of being able to defeat the disease before it becomes severe is much greater.
So now we're going to talk about some ways you can kind of test yourself on your breathing. First is a breath hunger test. So to do this, we're just going to simply take in a normal inhale through the nose, a normal exhale, and then we're going to hold the breath. And what you want to do is see how long you can hold your breath after a normal exhale. And I'll do a quick example to show you what it looks like. So I'm just going to breathe in and out twice, and on the third one, I'm actually going to keep my mouth closed after I exhale and plug my nose. Now I'm not going to do that as long as I can possibly do it because we'd be wasting video time. But you're going to, after you plug your nose and keep your mouth shut, you're going to see how long you can breathe until you feel the first real need to breathe. You shouldn't be and trying to hold your breath like it's a contest. That first real need to breathe when you go, ooh, I'd like to take a breath now. Because when you let go, if you take a gasp of air, you pushed it too far, and that's an inaccurate reading. So how long would that be? Well, if you can't hold that breath after that exhale for 5 seconds, that's what we would consider a respiratory issue. We would want to improve that for sure. You should be in the 15, 20, 30 second range really for what we would consider good respiratory function for that test. Second test is the chest versus diaphragm breathing. So fairly simple, turn to the side. All you're going to do, and a lot of our clients have done this before, done what we call kind of high-low breathing. One hand's on the chest, the other hand's on your belly, and you're just going to breathe normal. Now what you're feeling for is your top hand moving or is your bottom hand moving? Because if your top hand's moving, you're being a chest breather, right? And you're not breathing with your diaphragm, because when you breathe with your diaphragm, that muscle is parachute shaped, and when I inhale, it contracts and goes down like a pizza. So that pushes the guts outward. So you should be breathing into that lower hand. But a lot of people don't do that just reflexively when they're not thinking about it. But that is how you should be breathing. So that's the second test. Last is the functional inhale and exhale. So for this, all you're going to do is after a normal breath, well, actually not after normal, what we're going to do is take a normal breath, and you're going to see how long you can actually inhale. So if I would start to inhale through my nose, so you want to be able to see if you, is that less than 5 seconds? Is that somewhere, which is not what we want? You should be able to inhale for longer, like at least 8 to 10 seconds, and even longer than that, ideally, for really good respiratory control. The same with your exhale. Normal inhale, and I'm going to exhale. And count how long I can do that exhale. Same thing, if you can't exhale for longer than about 5 seconds, that would be considered dysfunctional from our standpoint. So try these tests at home and write a note to us, tell us how you do, and if you have any questions, let us know and we can help you out.